questions after the next presenter, who is Anastasia Loukaitou-Sideris, who is a professor here at UCLA in urban planning. She's also associate provost for academic planning. And she's done a lot of different research. She has a background in urban planning and architecture. She's looked at perceptions and use of different kinds of spaces, different population groups, and today she's going to be talking about seniors. Thank you.
Thank you, and thank you very much for inviting me. It is an honor to be here to celebrate Dick. I want to say that the seeds for the study I'm going to talk about were planted a few years ago. I was traveling in Asia. I was to give a couple of talks in Shanghai and in Taipei. And when my hosts asked me what I wanted to see from the city, I said, well, take me to your parks. So when we visited the parks, one thing was quite different from the American parks. There were a lot of older adults. I'm probably the most present group at the parks were older adults. And they were exercising, and there were low-impact exercise machines, and they were socializing. And my host said that, we have programs for older adults. Even the pathways are designed in ways that are softer, better for their feet. So I came back here, and I started looking to see if there are any senior-friendly parks. Well, guess what? There is none in the US. Europe has them. You find a number of them in Western Europe in particular, in the UK, in Germany, in Northern Europe, in Finland, in Malaga, in Southern Europe. They have the so-called geriatric parks where they have even people helping older adults exercise. And this is happening in a time when the fastest growing segment of the American public are people over 60. And this is a good thing, but what is a bad thing is that our cities are not planned and designed well for older adults. And I think this is a huge issue that planners and urban designers and public health professionals have to deal with, and policymakers, because otherwise we're all in trouble. And we know there is, and I know I'm preaching to the choir, that parks are very important for health, and particularly for the health of older adults. And this is a diagram that came out from the World Health Organization in 2007 that has the components of an age-friendly city, and one of the petals, or I should say half of a petal, is parks. And we have study after study after study about how parks are important for mental and physical health benefits. They can promote physical activity. They can reduce social isolation. They can reduce stress. And even in certain cases, people who have various diseases, they may heal faster if they have access to greenery and open spaces. However, and as you actually, I was not at all surprised by, I was surprised by a number of findings in the previous presentation, but what I was not surprised was that people over 60 or over 65 are really, you cannot find them in the parks, are very much underrepresented. They're the most underserved group in terms of parks. And this is, again, even though parks offer to all three attributes of health, the biological, the psychological, and the social aspects of health. We know that access and exposure, we have the empirical studies that show that. So I started looking into the literature to see what I could find. And there are studies that document the benefits, but there are almost no studies asking older adults, and actually in all this process, which has a number of funders, the study, and one of them is AARP, I found out that now we really should be calling older adults and not seniors. It is, what I could not find in the literature were studies that were asking older adults what are their needs and values and what they want to see. And of course, there were even less studies about how we should design and plan parks. And of course, as I mentioned, absent of parks completely. And this is not so in different parts of the world. You can see some images from Japan. Hyde Park has a segment of its park that is a playground for older adults, and only people over 60 can use these machines. The same thing happens in Taiwan. Even our neighbor to the north, Canada, there are senior-friendly parks. So we started this study that is actually funded by the AARP, but segments of the study are also funded by a number of other foundations like the Gilbert Foundation, Archstone Foundation, and even the Mineta Transportation Institute. These were the three main questions. What are the open space needs? We decided to concentrate on low-income inner-city adults in Los Angeles, basically under the rationale that these are the ones that have the least amount of options for physical activity and exercise. What are the challenges that they're facing in visiting neighborhood parks? And what are appropriate design suggestions for age-friendly parks? And a little bit about the literature. As I mentioned, there are very few studies about what attracts older adults to the park. There are studies about what attracts children to the park. I have authored one such study, and there are many more. We know very little about what deters older adults and what is the differentiation of preferences among different groups of older adults. And there is quite a heterogeneous group, I should say, not only because of ability, and then you have what gerontologists called the young old, old, and old, and that is a difference there, but also race, ethnicity differences, and gender differences. And there is almost nothing about age-friendly park planning and design. A few numbers in terms of Los Angeles County. We have almost 11% of the population that are over 65. A little bit over 60% of them are non-white, and about 11% are below poverty. So we decided to tackle the study by collaborating with St. Barnabas Senior Services. This is a senior services center, the larger in Los Angeles. It's over 100 years old, and it has different outlets, but its larger, its headquarters are in Westlake, and it primarily serves low-income older adults. Most of them are Latinos, Korean, and Filipinos, a few whites, a few African Americans. We run 8 focus groups, 5 with older adults, 2 with staff, and 1 with caregivers. And we have numbers and numbers of transcripts, and actually the study was published by the Journal of the American Planning Association. But if I wanted to summarize what we found, what is appealing to them is safety and security, and they talked a lot about human threats, but also environmental hazards, about tipping and falling. They like a park with natural attributes. They want to hear the birds and the squirrels. Remember, these live in very harsh inner city environments with almost no trees. They really want to have support for social interaction. They want to have programs that bring them together. And so age-friendly design and programming, and I will explain in a bit what this means. And they also talked a lot about accessibility. It is not only to have a park, but how do we go to the park? Most of them do not even own cars. Just parenthetically, I want to show you how other countries, these are from Spain, London, from Malaga, London, Berlin, and the bottom are Beijing and Helsinki and Madrid. And these are, again, how these cities are retrofitting their parks with equipment to keep older adults physically active. So the perceived dangers, by the way, there is a park near St. Barnabas, and it's MacArthur Park. Almost none of the older adults we talked to visited this park. They talked a lot about the perceived dangers that they see. They talked a lot about unsupervised children, and they're very much afraid that a soccer ball is going to hit their face, or they're going to be run down by children playing or skateboarding. They talked a lot about crime, about gangs, about people who are drunk. They were intimidated by homeless population. There was a lot of a recurring theme about a lack of respect, that they feel they're not given the appropriate respect by planners, policymakers, park staff. And the fear of tripping and falling was a major concern. I want to say a few things about walking, because we did a number of things with them. I don't know if you're familiar with Kevin Lynch, was an urban designer, professor at MIT, that back in the 60s, he would take people, not older adults, around the block and ask them to talk about their neighborhood. So we decided to do that with these older adults, to take them around the neighborhood and have them talk about the pleasures or the joys or the displeasures of walking. And we were quite shocked about what we encountered and what we heard. There are no pleasures of walking in the inner city for these older adults. The environment, there are physical and social impediments that really make it extremely difficult to not to go to the park, to even go to the supermarket for everyday life necessities. The sidewalks are cracked and uneven, very high curb. There is graffiti and trash, and especially I have all these pictures that I could show you, but I don't want to get you depressed. There are trash everywhere. They were talking about dead rats that they have to go over. They were talking about the complete lack of shade. We know that Los Angeles becomes extremely hot in a lot of days. There is absolutely no tree on the sidewalks. They said that they really, at many points, they would like to be able to rest. There are no benches, with the exception of some bus stops where the 1 or 2 benches at the bus stops were occupied. And there is traffic and dangerous intersections. And actually, at the end, when we came back from the walk on the block that we took individually, we had them individually, and we matched them with graduate students. And we asked them to tell us what was the thing that was the most stressful. Most of them said that trying to cross an intersection, we have these huge wide streets, and the light turning red in the middle of the intersection. I mean, when we really want to have people become active, and walking for older adults is the #1 type of exercise, and you provide an environment that is completely antithetical to walking, how do we expect them to walk? These are the social impediments that they encounter. And by the way, I didn't mention this. We also did this word cloud and so the font size is in proportion to the times that this appeared in what they were telling us. And as you will see, for the physical impediments, trash was the biggest thing. Shade, cracked sidewalks, uneven, and there were other things like benches, smells, trees, which was lack of trees, etc. The social impediments, there was a lot of discussion about how they're intimidated by people who are street corners or hanging out, who are drunk. They were concerned about the homeless people, especially having to go over the bodies of people who are sleeping on the sidewalk. They talked about drug dealing, people urinating at the sidewalk. They were concerned about street vending because they saw it as a sidewalk obstruction, because these are narrow sidewalks, and again, it forces them on the street, and they're afraid that they are going to be hit by a car. They're afraid of gangs. So we started putting together certain design guidelines for age-friendly parks, and this is actually, I will give you the website, everything is online, and we created guidelines around the themes that came out from the focus groups: safety and security, contact with nature, age-friendly settings, accessibility, physical activity, social support. There are a lot of guidelines, and I don't want to tire you with all that, but I'm just going to touch upon a few things. In terms of safety and security, extremely important to have opportunities for natural surveillance of the park by bystanders, community volunteers who may intervene if necessary. There was a lot of discussion about having good maintenance at the park and a park that is clean. I cannot tell you how many times we heard this, no trash. But also other things, such as the attention to the slope of these walkways that Debbie was talking about, ramps, handrails, the pavement, so that it is easy on their feet. But it is, I also want to emphasize, it is not only the park, but also the importance of the route to the park, and that this route is safe. Otherwise, you may have the nicest park, people are not going to visit it. In terms of contact with nature, I think that is not very different from what most people, especially adults, want from their park. They talked a lot about greenery, about flowers. Some of them talked about opportunities for gardening, wildlife, the ability to hear the birds, see butterflies. They talked about water elements. By the way, in the focus groups, we also showed them a number of photographs to encourage discussion of things that they liked and didn't like. So we would show them photographs of different park settings from different parks. There was a lot of discussion about ergonomic design and the type of seating and the material. And this is extremely important, that there is support for the back, that there is support to be able to get up and hold on to the seat, that there is, for people in wheelchair, enough space to be near the picnic table with their wheelchair, trellises for shade. Restrooms were very important. There was a lot of discussion about restrooms. Accessible water stations. All these are design guidelines that we have created that if you want to download, you will see. And then a lot of discussion about accessibility and guidelines around the issue of accessibility. How do you create safe sidewalks? Parking availability near the park, because a number of them, I mentioned, do not have cars, but some have, and some come with friends and family. The proximity of transit. Some people also take the bus. So if there is a bus stop near the park, that's much more easier than if they have to walk a couple of blocks, if it is difficult for them to walk. There was a lot of discussion about signage and wayfinding, even the font size, so that it can be seen, where the height of the sign, so that it is quite visible for people who are on wheelchair, age-friendly programming, and signs in different languages, especially when we're talking about ethnic communities. In terms of physical activity, walking was the most desired type of physical activity, but they really talked about the fear of being overrun by people who want to walk faster, or also feeling awkward if they are really blocking other people from walking. So we may start thinking about if there are certain parks in other parts of the world that you have different types of walking, some that are more for slow walking and others that are for more people who want to jog or run. Low impact exercise machines, but also other activities, programs. I'm going to go very fast because I have only 1 minute. Social support, that involves programs, the type of seating, which I'm not even going to say what sociopetal is. You can ask me because I don't have time. And also settings that may allow for privacy. This is just to show how bad Los Angeles is doing in terms of parks. We're spending only $60, that was in 2010, per resident, and other cities on the West Coast are doing much less. This shows a series of GIS maps about park inequities. We really calculated a senior park need index to kind of taking into account where seniors live, low-income seniors, where affordable housing for seniors exists, and where parks. And we find that the great majority of low-income seniors live in the inner city, which are these districts over there, but these are not doing great in terms of parks. And these are the census tracts in these districts. These are the planning districts. that have very high park need for older adults. And then we decided to really look into available vacant spaces that are under public ownership as a way to make it more easy for policymakers and Parks and Recreation Department to create these parks. And this is in another study that is also, you can download, that is called Parks for Seniors. I'm happy to say that we are going to have pretty soon the first older adult park in Los Angeles, the Golden Age Park. I'm collaborating with the Los Angeles Neighborhood Land Trust, and they are building a small park near St. Barnabas. And so that's my last slide. We really, in terms of, this is more of a for policymakers who are interested in creating these parks to identify locations of highest need by taking into account concentrations of older adults in the city, identify vacant lots that are located in census tracts of high park need, carefully consider the neighborhood context, and incorporate input from older adults in park design and programming, develop parks for older adults in highly accessible sites, include design and landscaping elements, and park programming that are age-friendly. And these are the two websites where these two reports, you can find the whole report, but there is also an article in the Journal of the American Planning Association. So thank you very much.